Since 2010, Anmac has been instrumental in building Australia's nursing and midwifery workforce. Our vision is for nursing and midwifery education and practice to be trusted, culturally safe, and advance the health and well-being of all Australians.
So an incredibly important part of Anmac's role has traditionally been a regulator in the health industry in Australia to actually assess people's qualifications and their education, to ensure that they're meeting the standards, making sure that we have a fit-for-purpose workforce for the future. Anmac's evolving. It's an organisation that really started very much behind the scenes, but we've understood that it's incredibly important to hear our voices as part of that thought leadership, working collaboratively with our stakeholders across the nursing and midwifery sector in Australia, helping advise governments and advise universities. We are working proactively with them in the future around that policy development and that education system development.
We protect the public trust and strengthen Australia's health system by ensuring nursing and midwifery education and practice are clinically and culturally safe through independent, evidence-based accreditation, skills assessment and thought leadership.
We are the guardians of public safety through the monitoring of education programs and accreditation of the nurses and midwives. Anmac assures the quality of education programs through the application of rigorous standards to make sure that the graduates that are produced from those programs are high quality, knowledgeable, they're clinically competent and they're culturally safe beginning practitioners.
We look at the existing evidence so that it will actually support the development of new standards or will support the existing standards. And we also look at where the gaps are, how we can address those.
Anmac is the designated skills assessing authority for migrant nurses and midwives. So nurses and midwives born overseas coming to Australia need to go through the skilled migration process. We provide advice to the Australian government on their visa-related decision making. There's a predicted shortfall of nurses, so the work that we do contributes to improving the workforce shortage. Overseas born nurses and midwives bring immense value. They bring experience, they bring knowledge. You know, the fabric of our society in Australia is we're very multicultural, so it makes sense that the people delivering care in your hospitals and aged care services are actually a representation of what our society looks like.
Our values of integrity, excellence, equity, courage and impact are the foundation of our culture and they shape how we connect, act and grow.
I love working at Anmac because of the people. The teams are committed to the work that we do. We all see the importance of the work, the value that we add.
It's full of people that share that vision of being genuine protectors of public safety.
There's a lot of kindness here and there's a lot of sense of the work that we do actually matters. Being able to contribute to shaping future nurses and midwives, it's nice to know that you can leave that sort of legacy.
I think we've got a really positive culture. It's a very collaborative organisation and workforce, so that allows us to make some really positive impacts.
The Anmac brand has been refreshed to align with our new strategy and better reflect our role in building a safe, capable nursing and midwifery workforce.
I really love the new Anmac branding. To me, it represents that confluence of nursing and midwifery coming together, but in a really contemporary and bold way.
It's a new colour scheme. The blues and the pinks are energetic. They bring a little bit more excitement, perhaps suggest that Anmac's here for a new era, a new time.
I love the colours. It's nice to move away from the brown and signifies a fresh start.
I'm really excited about the opportunity to be part of that journey as Anmac leads the way to the future.
Anmac, for a safe, capable nursing and midwifery workforce.